that's an indication that an ultrasound is needed to see what's going on. The other thing is this: fundal heights can be affected by the maternal body habitus, meaning what their belly looks like. People who are on the larger side, I don't mean that disrespectfully, or that carry their weight up higher, can have a falsely elevated or smaller fundal height. So we have to take into account body habitus. People have had multiple abdominal surgeries for any reason, including abdominoplasty. It's harder to figure out what their fundal height is in pregnancy, especially as they get further along. Now, second thing, having a history of having big babies. This is what you should ask. I've had big babies in the past. She had 9-1 and 10-1, and I'm just speaking generally, not specifically about her care. We need to know, was diabetes present in either one of those pregnancies? And did you have any complications with the delivery, pushing the baby out, and was there a shoulder dystocia? Depending on what the answers are to those questions, depends on the surveillance we should do in the pregnancy regarding screening for gestational diabetes earlier in pregnancy, or doing serial fetal growth ultrasounds to track the growth of the current pregnancy, the fetus in the current pregnancy. If we know patients have had big babies in the past, like 9-1 and 10-1, spontaneously via the VAGINA, and there were no complications, no major tears, there was no shoulder dystocia, that's a good sign. Some people can have big babies and not have those complications. So that's why getting a complete and thorough history on those prior pregnancies and deliveries is key. So having a baby that's measuring big, or a fundal height that's big, I'm not saying not to be stressed out, but it does not guarantee you're going to have a bad outcome, or a bad pregnancy, or a bad delivery. By and large, most of those pregnancies and deliveries are just fine. But your obstetrical care provider should know your complete history in order to make the best decisions for surveillance and what should be done or not done during your delivery based on that pregnancy history and what's happening in this current pregnancy.